Hi, I'm Dr. Michael Henry from TexStar Chiropractic Clinic. I wanted to talk to you for just a couple of minutes about something called spinal manipulation. You've probably heard the term that or adjustments, or I'm going to go get my back cracked. Well, that's what we're talking about. Chiropractors in the U.S. have been using spinal manipulation for over 100 years to address aches, pains, and other health issues of their patients. But the art of adjusting has been around for much, much longer than that. There's even references to it in ancient texts from Europe and Asia. There's some Greek texts that reference it. Adjustments are what chiropractors do to address the biomechanical issues of the spine. It's really one of the main tools we use to correct a lot of the problems in your spine. While we have a lot of newer techniques, this one has been around for a long time because it works. By getting the joints moving properly in your spine, we can help relieve your back pain and other signs of symptoms caused by nerve problems, or when the spine's not functioning properly, it can cause inflammation and irritation. That's one of the biggest things that we see with back pain. This treatment's very safe and effective. There's lots of studies out there comparing it to the other treatment options for similar kinds of problems, and it's one of the most effective and safest options out there. And the best thing is it only takes a few minutes and is quite a bit easier than drugs and surgery. In fact, according to one study, 95% of people who had been to see a chiropractor in the last year considered the treatment very effective. Even the American Medical Association has recently recommended the use of spinal manipulation as a first line of defense for things like acute low back pain, as opposed to going straight to opioids and other kinds of medications that we have lots of problems with right now. It's a common misconception that adjustments are uncomfortable, or that they might hurt, or even that they require you hearing that popping sound that some people don't like. While typical adjustment does produce that popping sound, there are lots of other ways that we can adjust your spine to help correct the problems. One of these include things like using adjusting tools like this one. This is called an activator. We do some soft tissue stretching and mobilization around joints, and even specialized tables that would use your own body weight to help move certain joints in your low back. So we really cater our treatment to each individual patient and make sure that if we're going to use spinal manipulation, we're going to use it in the best and most effective way possible.